some big ego was one of the mistakes coming into place, because this was also one of my first cases. And what I always say also to our students, you should not start with vertical unless you have done 20 to 30 lateral bone augmentation. So it's all like a learning curve. You should not start with some things which are a little bit more complicated, because with tunnel technique, you have less good overview. Not start with these things too early. So take your time, leave your ego at home, and give the best and the most predictable outcome to your patients. So 3D vertical crest augmentation of posterior mandible using tunnel techniques. That means also another 10-year clinical study from 2022, actually quite new. And what was impressive here, we are talking about vertical bone augmentation. So the supreme discipline when we are talking about bone augmentation. And we had less than 1 millimeter vertical bone resorption after doing this with purely autogenous bone. And on average, you don't see my cursor now, but on average, we were able, you see the line above, on average, we were able to gain almost 8 millimeter height. And we know that this is also not in a predictable way possible with bone substitutes. The absolute maximum, and this is also not predictable in my way, is 4 millimeter. So when you want to do vertical bone augmentation, there is no way around autogenous bone, because this is the only gold standard also, because only autogenous bone is osteoinductive, osteogenetic, of course also osteoconductive, but substitutes only work as a scaffold or a framework. They are only osteoconductive, and you have to have luck so that the patient has a good regeneration potential. Otherwise, it's not working. So the nice cases you usually see on the also on the big stages are cases done at patients with good regeneration potential. And of course, afterwards, we always know that if it works or it doesn't. But when we're working with autogenous bone, we don't want to take that risk. That's why we, even without knowing if the patient has a good or a bad regeneration potential, we always go on the safe way, which is working with osteoinductive material.